the owner of Felicia's Daycare, Savannah, Georgia, for over 35 years. My issue is with caps. Since they changed the system over from maximum to caps, I have not been paid the right rate that I'm supposed to be paying. They're paying me $100. My rate is $125. I've been 3 stars since I've started. It's kind of hard for me right now. I just lost a husband a year and 10 months ago. I'm not used to it, but one income home, and it's hard. I have a daughter in college that I would love for her to stay in college, but I need my money from caps. I need the adjustment paid. So, like I said, I just want my daughter to stay in college and get her education like everybody else. And when cap is not paying me my money, it's not going to happen. Those $5,000 is not easy to get. So I need help. I didn't know who I need to talk to, but I could receive my funds so I could see my last daughter in college.
Hi, my name is Sandra Shepherd. I'm the owner of Little Shepherd Learning Academy in Savannah, Georgia. My grievance is not being paid on time. I don't know why we were switched to another company that we wasn't aware of before it happened. And I have been having problems ever since Cap switched to this new company, not being able to get paid on time. And it's like now we used to get paid every week. If we submitted our invoices on Sunday, by Wednesday, we was paid. Now, they're telling us we can submit our payments in on Friday after 5 p.m. We're guaranteed to get paid by that Tuesday, but that's not the case. It seems like we're getting paid now every 2 to 3 weeks, not every week like we are used to. It's just hard for some of us. I know for myself, when I was awarded the stable grant, God knows that helped me a whole lot as far as finances and being able to keep my doors open. Yes, I have continued to keep my doors open because fortunately, I have a husband that supports me. And that is how I'm able to keep my doors open. When these parents come, they don't want to pay their portion that they are supposed to pay. They don't want to help. So then I'm still keeping kids that are on caps. Then you tell me that the only way I can continue to support cap kids is to go through quality rating. I have been through quality rating. I just got finished. This is my 4th time around going through quality rating. I've been a 3-star ever since. This time here, I got a 2-star. So I just want to say that I wish that we could go back to the old system that was in place because we had no issues whatsoever. But now there are so many issues out here that we cannot, me, myself personally, and other providers, we can't do anything about it. And we're calling, we are texting, we're emailing, we're not getting any response from anyone. I know that I'm not.
Good afternoon. First of all, thank you, DECAL, for the opportunity to come here and to hear us. We appreciate you for that. I want to also say I'm a family child care provider. I'm from Savannah, Georgia. And my question is, was too much put on DECAL? Because DECAL, you're responsible for fingerprinting, background checking, licensing, and all of this other stuff that you already had under your hat. So was too much put on you with caps? That's my question. Because obviously there's a loose screw, but can we figure out how to tighten the bolt? Thank you for the opportunity again.
Good morning, everyone. My name is Frances Gillison. I'm a community organizer with 9 to 5 Georgia on behalf of the child care providers that are present. We are small, but we're mighty here. And the reason that is because these meetings are during hours that they have to keep kids. And so this is a bigger issue, and everything that has been stated earlier, it's continuing to happen across the state, but we only have these few voices that are lifting these issues. So we just ask that these issues are being taken into consideration and really looked into deeply to understand and really help our, not only Savannahans, but whoever else is experiencing these issues. Thank you.
Good afternoon. My name is Kaniki, and 7,000 kids, up to 7,000 kids, and you're trying to get it back down to 50,000. It's way more kids that need assistance, parents that need assistance. My issue was, I had a parent that applied for CAPS 3 times in the last year. The first time she was denied because they said she didn't turn her paperwork, but she put it in, you didn't get it. The second time she was approved, but before she could get her own paperwork in, before the deadline, they came back and said that she was denied. The third time, which was last month, she applied again, she was denied because she only fit 2 of the priority groups. Her income, she worked full time, but the third question was she was not young enough. She didn't mark that she was under 21 years of age. This parent, Savannah is a hospitality city, so we all know that income is not where it's supposed to be. She's homeless. She doesn't receive food stamps or Medicaid. How can she pay child care and also feed her kids and also provide medical care for her kids? It's impossible. I took those 3 kids on the stable grant. That was able to help me give better service to her and her kids. Since the stable grant has ended, her kids are still there. I cannot charge her because she has nothing to give me. So I make sure that the food program is something to supplement. She's on my no comp form. So those 3 kids, I make sure that they eat before school, they eat when they come from school, and they eat before they go home. It's hard to tell a parent that, no, I can't take your kid because you cannot pay. If we make CAPS available to as many people as we can, we can help them out. I was a young parent, and I knew how it was. I was going to school for childcare, and my instructor helped me. She let me bring the kids to daycare at Savannah Tech. And she's also the food program that I'm in now, and I've been with her for 13 years. And it's just that it's not fair to the parents that need it. And we talk about mental health. If the parents' mental health affects the kids' mental health, if the parent can't go to work and be satisfied that their child is in a quality environment to teach and learn, it's hard for that parent to go to work and be focused on their job. They say Georgia is the best place to own a business, but it's not a best place for employees to work because they got to work about paying for childcare. My rates are so low, and it's still, I'm barely surviving, but I'm surviving because I have faith in God. I have faith in 9 to 5 that came from above and helped me to make sure that my bills were paid. Sometimes it gets overwhelming, but I'm doing this for the kids. It's in my heart. I have been doing this for over 20 years. I started out in pre-K. I left to go for accounting for 2 years, but I couldn't finish because I missed my kids that much. So I decided to open up a childcare facility in my home. I have served so many kids that even after they leave, I still attend graduations. I attend birthday parties. I attend baby showers for my kids that I have already taught. And if those parents are the ones that come back to me to say, Miss Nikki, do you have a spot for my kids? But family home child care is only allowed 6 kids. 6 kids for pay at $100. And I'm not even getting $100. That's $600 a week. Times 4, that's 24, my mortgage. I'm in Savannah. And y'all know the rates, the home value in Savannah is shooting up. I don't want to lose my home. I don't want to lose my kids because I'm quality rated 3 times. The first time 2 stars, the second time 3 stars, the most recent 2 stars because they changed a lot. It's not fair. And the reimbursement rate, the TLM package is set at the base rate. Savannah is low, Atlanta is high. But Savannah is the low income. Savannah cannot make it without CAPS because we got parents that need it, not want it, but need it. So please just consider adding extra funds because from my understanding, there's $16 billion of surplus that Georgia has that's not being put anywhere. Lend it to the child care. help us help the kids. If y'all want mentally healthy children, it starts with the parents. And if that parent can go to work and say, I know that my child is taken care of, that it trickles down to that child because that child is happy doing this. They were right. I didn't have not, well, I can't say I didn't have not one unhappy child, but more my parents were more happy because guess what? They could drop their child off and not have to worry about coming out of pocket. So think about that. Think about just the help and increase, and even if you can't increase back to the 70, help with something, because we got a lot of parents that's on caps that don't need it. So look into your system. Look into what could be done to help more parents. We're all thankful that we do our work. And if y'all still want quality rate, we're doing quality rate because in order to get caps, you have to be quality rate. We're busting our behinds trying to make sure that everything is right how we're supposed to have it.
Yes.
Thank you.
Yes.